Hi, I'm Dr. Bonner with Pain Consultants USA, and today I'm going to talk to you a little bit about lumbar epidural steroid injection. So, this is a procedure commonly performed by pain management physicians. It's usually done for low back pain that radiates down your leg or both legs. Sometimes it's just done for low back pain, but really evidence supports it best when you have low back pain that kind of shoots down your legs. This is commonly referred to as sciatica. So if you use that term to describe your pain, you might have this procedure done to possibly alleviate some of your pain. So what is this procedure? It's a procedure that we take a needle and we put it into the lumbar spine region. This is your lumbar spine, okay? And this is looking at it from behind. So if we were coming at it with a needle, there's two ways that we can really perform this injection. One approach would be going through what we call the interlaminar approach in this space here where you see the yellow between the two whites. So the white here is bone, and then we want to go in this hole right here. We put the needle through there, which leads into the spinal canal, inject the medication. Or we can do what's called a transforaminal approach, which is where we take the needle and we place it right in this space called the foramen here. There's a hole at each level of the spine on each side, so you can do it either on L5, S1, L4, L5, L3, L4, and so on, and you can do it on either side depending on which side the pain is on. And we do the same thing. We put the needle in that area, and then we inject the medication in around the nerve and into the spinal canal or the epidural space. That's why it's called an epidural injection. So what is typically injected in here is a combination of different agents. Number one, usually there is contrast agent injected. That contrast is used to make sure, number one, the medication is flowing into the appropriate space. So we want to see the medication flow into the epidural space and not just out of the canal. So sometimes we might inject the medication and we see that it actually just flows away from the spine, and we want to see it flow into the spinal canal. Okay. Number two is we want to make sure the medication doesn't go into a blood vessel. So sometimes the medication, actually we inject in this area, there's a little blood vessel, we see the medication just disappear because it's flowing directly into a blood vessel, and we don't want to see that happen. And then number three, we really want to confirm we get good flow around the nerves that we suspect are causing the pain, and so we can usually see that with the contrast agent. The second thing that's usually injected is usually a local anesthetic, like you might have heard of lidocaine. That provides a quick numbing effect of the nerve. So often that will help us determine after the procedure, okay, is this procedure beneficial at all? You might get up from the table and say, oh yeah, it feels great, the pain totally went away. That's usually related to the lidocaine around the nerve having an immediate effect, because the third thing that's injected is a steroid or cortisone type medication, and that takes a couple days maybe to have an effect, and so that one would be less likely to give you the effect kind of right away when you have the procedure done. And so who does these procedures? So this procedure should be done by a physician with special training in using image guidance to inject medication around these nerves. So this might be a pain management doctor, it might be an interventional spine doctor. Sometimes orthopedic spine surgeons or neurosurgeons will also do these procedures, but if you're having this procedure done, it should be done with some type of image guidance. So that is most commonly what's called fluoroscopy, or we call it a C-arm, where there's an x-ray machine that is sort of C-shaped and it wraps around the table, and we can maneuver it to get different pictures from different angles to ensure that the needle is in the correct place when we're about to inject the medication. It's very important that we don't kind of venture anywhere with the needle that might be dangerous for you, like right into one of these nerves. That would be bad. So we want to put the needle in a place that we know is safe, and there's common locations for that, and that's what the training is all about getting. So you want to make sure you have someone who's trained in using imaging to do this type of procedure. Some other image modalities that might be used for this procedure would be ultrasound. So an ultrasound is like most commonly people know it from pregnancy. When you have an ultrasound to look at the baby, you can also ultrasound to look at the spine. The problem with ultrasound is we can't use contrast to make sure the medication is going to flow appropriately like it does with fluoroscopy or x-ray. But ultrasound can be used for these procedures also. And another imaging modality that's commonly used is CT scan or computed tomography. And that's just a little more in depth. That takes a more of a 3D picture, really, and may not be necessary to have. But if you're getting it done with CT, you're likely to have it placed correctly, because you can be very, very particular about where you put the needle and how the medication flows. You will also be getting a lot more radiation than if you just have fluoroscopy done. And if you have ultrasound done, you'll be getting no radiation. So that's some of the differences there. And where is this procedure done? Sometimes it's done right in the doctor's office. Some doctors have the fluoroscopy machine right in their office, or an ultrasound right in their office where they can do this procedure right there. Sometimes this is done in a surgery center, where outpatient surgeries are done. You go in, you get the procedure done, and you leave the same day. And occasionally these procedures are done in a hospital. Sometimes that's just preference of the person doing the procedure, and sometimes that's just related to the practice location. For instance, a practice that's associated with the hospital, you may just be more likely to have the procedure done in the hospital. So those are some of the common questions and common information that you would need to know about having a lumbar epidural steroid injection done. It should be done most commonly for pain that radiates from the back into your leg. And it should be done by someone who's trained in doing these procedures with image guidance. You should not have this procedure done for low back and leg pain without image guidance, because it's readily available in most locations in the United States, and can be done very safely when done with appropriate precautions and by someone with appropriate training. If you have any questions, please feel free to reach out to us in the comments or at info@painconsultantsusa.com. Thank you.